Welcome to the Deep Dive. Today, we're plunging into something absolutely critical for community pharmacies in England right now. The Pharmacy Quality Scheme for 2025-26.
Yeah, this is a really key element of the Community Pharmacy Contractual Framework, the CPCF. And it's essentially designed to recognize and, well, reward pharmacies that are delivering high-quality services.
Focusing on things like patient safety, clinical effectiveness.
Exactly, and patient experience, too.
And we've gone deep into the source material for this, navigating the guidance directly from NHS England and Community Pharmacy England. It's packed with detailed deadlines, requirements.
It really is. Our mission in this deep dive is basically to cut through all that complexity. We want to pull out the essential information you need to understand the PQS 2025-26.
Like, what exactly does it require? What are the absolute non-negotiables? And, importantly, why should you care?
Think of this as your essential briefing, your guide, really, to make sense of the scheme's crucial criteria and timeline.
Let's get into it then.
Absolutely.
Okay, so let's unpack this. Just at a high level, how does the PQS fit into the picture for pharmacies?
Well, first off, it's a voluntary scheme, which is important to remember. Pharmacies aren't, mandated to participate.
Right.
But there's a pretty significant incentive. For this 2025-26 period, there's $30 million in funding set aside to reward pharmacies that meet the quality criteria.
$30 million.
Okay. And the scheme itself officially kicked off on April 1st, 2025, and it runs right through to March 31st, 2026.
So it's about choosing to meet specific quality standards, and there's funding tied to that. And for anyone engaging with this, the timeline is absolutely make or break, isn't it?
Oh, it really is. If you miss a key date, you can miss out on the payment entirely. The most critical window is the declaration period.
Right, the declaration.
This is when a pharmacy needs to go online using the MYS portal that's manage your service and actually declare that they've met the requirements for the parts of the scheme they're claiming.
And that window is quite precise. I mean, you can't miss it.
Very precise. It opens at 9 a.m. on February 2nd, 2026, and then it slams shut at 11:59 p.m. on February 27th, 2026. That is your moment to declare.
Got it. February 2nd to 27th, 2026. So you declare then, but the actual work, when does that need to be completed by?
That's a good distinction. The evidence, the proof that you've met all the criteria you're claiming must be in place by the very end of the scheme year. That's March 31st, 2026.
So the declaration window is before the final evidence deadline.
Exactly. It's an important nuance. You declare you're eligible before the absolute cutoff for having everything finalized and documented.
Okay, that makes sense. What about that aspiration payment we heard about earlier in the year? How did that fit in?
Right, yeah. So for those pharmacies who chose to claim it, there was an optional aspiration payment window back between May 1st and May 16th, 2025. That payment, which was basically a percentage of potential earnings calculated at the minimum point value, is scheduled to be made on July 1st, 2025.
So that's coming up soon for those who claimed. And the main PQS payment, the final one.
The final payment for all the domains you successfully declared and have the evidence for, that will be made on April 1st, 2026.
Okay.
So you've got the scheme year running now, the optional early payment in July if you went for it, the crucial declaration in February 26, the final evidence deadline end of March 26, and then the final payment landing April 1st, 26.
Laying it out like that makes the sequence much clearer. Now, you mentioned eligibility. Before a pharmacy can even think about getting points for meeting criteria, there's something called the gateway criterion. This sounds like the absolute first hurdle.
This is where it gets really interesting, you're right, and it is completely non-negotiable. If you don't meet this gateway, you are not eligible for any PQS payment. Doesn't matter how many other criteria you tick off.
It's the entry ticket.
Exactly, your ticket in.
So what's required for this gateway? What do pharmacies need to do?
Okay, it mandates that a pharmacy must be signed up and actively registered to deliver both the NHS Pharmacy First Service and the NHS Pharmacy Contraception Service, the PCS.
Both. Not just one or the other. It has to be specifically both services.
Yes, both are absolutely essential. And this isn't just a case of being signed up at the very start of the scheme. You must be registered for both by the end of August 31st, 2025.
Okay. End of August, deadline for sign-up.
And crucially, you need to maintain that registration continuously right through to the scheme's end date, which is March 31st, 2026.
Right, continuous registration. So how is this checked? Do you declare this on MYS during that February window?
No, and this is a really key point. The gateway criterion isn't declared on MYS. NHS England will verify your registration status for both services after the fact.
Ah,
It's part of their post-payment review process. They'll be checking if you were registered for both services throughout that period from September 1st, 2025 to March 31st, 2026.
so if for any reason a pharmacy, say, deregisters from Pharmacy First or PCS during that September to March period, they've effectively disqualified themselves from the entire PQS payment for the year.
Precisely. That registration must be active and continuous for both services throughout that specific window to pass the gateway.
Wow. Okay.
The sources do mention some specific allowances, sort of transition arrangements for pharmacies that open or perhaps change ownership after September 1st, 2025. They get a defined period to get signed up for both services to still meet the gateway.
Which makes sense. Yeah, you need a path for new businesses or changes.
Definitely.
Okay, so assuming a pharmacy navigates that gateway successfully, they can then start working towards the quality criteria, which are organized into domains. How are those domains structured?
For 2025-26, the scheme is structured around two main domains: medicines optimization and patient safety.
Right. And you mentioned ticking boxes earlier. You can't just pick and choose criteria within those domains, can you?
Absolutely not. That's a firm rule. To earn the points for, say, the medicines optimization domain, you must meet all the specific quality criteria listed under that domain.
All of them.
Every single one. If you complete 4 out of 5 criteria in medicines optimization, you get 0 points for that domain. Same rule applies to the patient safety domain, all or nothing for each domain.
Okay, clear. And the potential points available, they seem to vary based on the pharmacy's workload.
Yes, that's right. They're split into 2 bands based on annual prescription volume. You've got Band 1 for pharmacies dispensing up to 1,800 items annually, and Band 2 for those dispensing over 1,800 items.
And Band 2 gets more points.
Yeah, Band 2 pharmacies have more points available. It's 30 points for medicines optimization and 20 for patient safety, making a total of 50 points possible. This reflects the, greater potential workload linked to seeing more patients.
Makes sense.
Band 1 has fewer points overall, but it keeps the same relative weighting between the two domains.
Got it. Right, let's delve into Domain 1 then. Medicines optimization. You see there are 5 criteria here, all needing to be met. What's the first one require?
Okay, the first criterion is the palliative and end-of-life care action plan. This actually continues work from previous PQS schemes. Pharmacies need to have or update an action plan specific to palliative and end-of-life care by March 31st, 2026.
This is interesting. Do all pharmacies claiming this domain need this plan, even if they don't regularly stock those specific palliative care medicines?
Yes, that's a really key point from the guidance. Even if you don't routinely stock the 16 specific critical palliative and end-of-life medicines listed, you still need to have this action plan in place by the deadline.
Okay.
If you do stock them, then you have an additional requirement. You must update your NHS Profile Manager by March 31st, 2026, and confirm your account shows you're a pharmacy palliative care medication stockholder.
Right. And what exactly should this action plan contain? What makes it useful?
It needs to be practical and locally relevant. So it should include details of locally commissioned palliative care services, things like on-call or delivery arrangements. Crucially, it needs a list of other local pharmacies known to stock those 16 critical medicines.
So you know where to send people.
Exactly. And also information on how to access parenteral haloperidol locally if it's needed. The guidance suggests using the Directory of Services, the DOS, to help compile that list of stocking pharmacies, though it notes the specific PQS update for the 16 medicines won't be visible on the public NHS website, so you need to check the DOS directly.
Okay.
This plan is really intended to be a practical tool you can use when you don't have stock and need to guide a patient or carer quickly and effectively. You must have the plan ready for inspection from March 31st, 2026, and keep it for 3 years for potential post-payment verification.
That sounds like a really valuable practical tool for those urgent situations.
Yeah.
Okay, what's the second criterion in medicines optimization?
The second one is linked to training. Consulting with people with mental health problems using CPPE learning resources. This ties directly into the expansion of the new medicine service, the NMS.
Yes, the NMS expansion.
Right, because from October 2025, depression will be included as an eligible condition for NMS.
So this training is basically preparation for pharmacists handling those NMS consultations for depression.
Exactly that. By March 31st, 2026, all pharmacists working at the pharmacy on the day you make your declaration must have completed this specific CPPE online training. And the validity period here is completion within the last 4 years. So, anytime since April 1st, 2022.
Is there an assessment attached to this one? Like a test?
No, the guidance specifically states there's no e-assessment required for this particular mental health training module. You just need the certificate of study from your CPPE record as proof.
Clear enough. Okay, moving on to the third criterion in this domain.
The third and fourth criteria both focus on respiratory care, specifically asthma management. The third one is about the use of a spacer device in children aged 5 to 15 years.
Spacers for kids.
By March 31st, 2026, pharmacies need to demonstrate that for children in that 5-15 age group who are prescribed a press and breathe PMDI inhaler for asthma, they have checked if the child has an appropriate spacer device. This should be guided by NICE recommendations, specifically NG 245.
And if they don't have one, or it's not right?
Then the patient should be referred back to their prescriber for a review.
Okay. Now, what if a pharmacy doesn't actually dispense to any children in that age group with that type of inhaler during the whole scheme year? Can they still meet this criterion?
Yes, they absolutely can. The guidance clarifies this. Even if no patients are identified for referral, the pharmacy is still eligible if they can provide evidence of sort of robust attempts to identify potential patients and show that they have established processes ready to make referrals if they were identified.
So it's about the process again.
Exactly. You declare on MYS that no patients were identified for intervention, but the core requirement is demonstrating you actively looked and had a process ready to go. And again, evidence needs to be kept for 3 years.
That makes sense. Demonstrating the intent and the system is key, not just the final count. And the fourth respiratory criterion, what's that about?
This one targets potentially poor asthma control, specifically looking at SABA overuse. By March 31st, 2026, pharmacies must demonstrate they've referred asthma patients who have been dispensed 3 or more short-acting bronchodilator inhalers, SABAs, the reliever inhalers within a 6-month period.
3 or more in 6 months.
Yes, and who don't also have a corticosteroid inhaler, a preventer prescribed concurrently. These patients should be referred to a healthcare professional, like their GP or asthma nurse, for a review of their asthma management.
Right, because that pattern suggests their asthma might not be well controlled. It's a well-known red flag.
Exactly right. Over-reliance on SABAs can mask poor underlying control and puts patients at higher risk. And just like the spacer criterion, you need evidence of robust attempts to identify these patients and having referral processes in place.
Even if you don't end up actually making any referrals during the period.
Correct. You still need to show you were looking and ready. Retain that evidence for 3 years as well.
So both respiratory criteria are really focused on proactive identification of patients who might need a review of their asthma management. Okay, what's the fifth and final criterion in this medicine's optimization domain?
The fifth criterion is about emergency contraception, or EC. And again, it involves specific CPPE learning, and this time an E-assessment.
Yeah, an assessment for this one.
Yes, and like mental health training, this is linked to a service expansion. In this case, it's the pharmacy contraception service, the PCS, expanding from October 2025 to include the supply of free oral emergency contraception.
So this training gets people ready for providing that service. Who needs to complete it?
By March 31st, 2026, all pharmacists and also any pharmacy technicians who intend to provide the PCS service must complete the relevant CPPE online training, and they must pass the associated E-assessment.
Pharmacists and attending technicians. Okay, what's the time frame for this one?
The validity period for this EC training and assessment is within the last 3 years, so completion since April 1st, 2023. You'll need evidence of both completing the training and passing the E-assessment kept securely for 3 years.
Right.
And the guidance does highlight that the CPPE website has a helpful PQS tracker tool that can really help pharmacy professionals keep tabs on their progress against all the required training criteria for PQS.
That sounds like a very useful resource, especially for busy teams trying to keep track of everything.
Oh.
Okay, so those are the 5 hurdles for the medicine's optimization domain. Now let's switch gears to domain 2, patient safety. There are 3 criteria here, and again, all of them need to be met to claim points for this domain. What's the first one?
The first one under patient safety is an antimicrobial stewardship clinical audit. This is focused specifically on the advice given during pharmacy first consultations, particularly for patients presenting on the sore throat pathway who score a fever pain score of 0 to 3.
Okay, so a clinical audit specifically tied into pharmacy first consultations for less severe sore throats. What are the audit specifics? What do pharmacies need to do?
The audit period itself runs from September 1st, 2025 through to March 31st, 2026. Within that time, you're required to audit a minimum of 10 patient consultations meeting those criteria, and you should aim to do this within a consecutive 4-week window.
10 patients in 4 weeks. What if you don't see that many eligible patients?
It's a good question. If you don't see 10 eligible patients within 4 weeks, the guidance allows you to extend that data collection period up to 8 weeks, trying to reach that minimum number.
Okay. And a crucial part is what you actually do with that audit data.
Absolutely critical. You must submit the anonymized data via the MYS data collection tool by the deadline, March 31st, 2026. But it's not just about hitting submit. You also have to demonstrate that you've reviewed the audit findings internally and, importantly, incorporated any learnings into your team's practice to improve the quality of advice given in these specific consultations going forward.
Right, the quality improvement cycle. What if, even with the extended period, a pharmacy doesn't manage to audit 10 patients? Maybe they just don't see enough people meeting the criteria.
Yeah, similar to the respiratory criteria, you can still potentially meet this requirement. You need to provide evidence of robust attempts to identify suitable patients for the audit. If you don't audit the minimum 10 patients by March 31st, 2026, you must still submit a declaration via that MYS data collection tool.
What does that declaration say?
It basically indicates that either no suitable patients were identified or you didn't reach the minimum sample size despite trying. And you still need documented evidence of your attempts and how you would incorporate learnings if you had managed to collect the data and find areas for improvement. Keep all that for 3 years.
Got it. Again, the process and the commitment to learning are vital, even if the numbers aren't there. Okay, what's the second patient safety criterion?
The second is focused on sepsis awareness. This requires completion of CPPE learning and passing an associated e-assessment.
Sepsis training. Who needs to do this?
By March 31st, 2026, all registered pharmacy professionals, and that specifically means both pharmacists and pharmacy technicians who are working at the pharmacy on the day you make your declaration, must complete this training and pass the assessment.
All registered professionals.
Okay.
And what's the validity time frame for this sepsis training? How recent does it need to be?
This one needs to have been completed within the last 2 years, so anytime since April 1st, 2024.
2 years. Got it.
And the guidance is quite specific here. To meet this criterion, you need to complete all 6 associated e-learning programs that make up the CPPE sepsis package.
All 6, even if some seem less directly relevant.
Yes, even if some might seem less focused on, say, typical community pharmacy day-to-day activities, the idea seems to be about building a comprehensive, shared understanding of sepsis recognition and response across different healthcare settings. You need evidence of completing all 6 modules and passing the e-assessment, kept for 3 years.
That sounds like a pretty comprehensive package.
Right.
Really emphasizes the importance of sepsis recognition across the board in healthcare.
Okay, what's the third and final patient safety criterion?
This is a significant one, and it's aimed at aligning pharmacy more closely with other healthcare professions. It's about regularizing enhanced DBS checks for registered pharmacy professionals.
Ah, the DBS checks, okay.
Yes. By March 31st, 2026, all registered pharmacy professionals, again, pharmacists and technicians working at the pharmacy on the declaration day, must have had an enhanced DBS check completed. This means either having the certificate issued or having a status check undertaken via the DBS update service.
And how recent does that check need to be?
It needs to have been done within the last 3 years. So the certificate issue date or the update service check must be since April 1st, 2023.
Right. So this is essentially ensuring a certain standard of vetting is met and maintained for all registered staff who are delivering patient-facing services. Exactly. The guidance explicitly states this is to support the safe provision of clinical services by aligning community pharmacy with the standards expected for other NHS healthcare professions interacting with patients.
Makes sense.
You need to have evidence of this check or the update service status available from March 31st, 2026, and again, retain it for 3 years for that potential post-payment verification. Navigating this DBS requirement might feel a bit new or complex for some pharmacies, perhaps particularly smaller independents, and it's worth remembering there are resources out there that can help with the process.
It's definitely a key requirement to note and plan for. Speaking of resources, and with all these complex details, criteria, deadlines, evidence requirements, it's a lot to track. What kind of support is available for pharmacies trying to navigate all this, especially thinking locally?
Yeah, navigating all the nuances of PQS, not to mention other NHS requirements, can definitely feel complex. It's a constantly shifting landscape. For pharmacies specifically in the Thames Valley area, your local pharmaceutical committee, Community Pharmacy Thames Valley, is a fantastic resource.
LPCs are key, aren't they?
They really are. CPTV, for instance, sends out a weekly digest every Thursday. That's packed with vital local updates, clarifications, reminders about deadlines, exactly the kind of stuff you need to stay on top of PQS and everything else.
Staying informed locally is absolutely crucial for success with schemes like this, where local context sometimes matters. And you can also find more information about Community Pharmacy Thames Valley and how they support pharmacies on their website. That's cptv.org.uk.
Mm-hmm.
Engaging with your LPC, checking those digests, looking at the website, it's a key part of keeping on top of everything, isn't it?
Definitely. They really are there to help pharmacies cut through the information overload and focus on what needs doing.
Okay, so we've covered the gateway hurdle, the crucial timeline, the two domains, medicines optimization and patient safety, and all 8 criteria within them. How does the funding actually translate from meeting these criteria into, pounds in the bank for the pharmacy?
Right, the money bit. As we mentioned earlier, there's that $30 million national funding pot. Your payment is calculated based on the number of points you earn. Remember, you only earn points by successfully meeting all the criteria within a completed domain.
All or nothing per domain.
Exactly.
Right.
So you get the points for the domains you complete, and that total is multiplied by a specific value per point. And that value per point depends on your prescription volume, band 1 or band 2.
Okay. And the value per point, that isn't fixed right at the start of the scheme year.
No, that's the variable element, which adds a bit of uncertainty. The actual final value per point will depend on how many points are claimed nationally by all participating pharmacies across England.
So it depends on national performance.
Yes. There is a ceiling, though. It's capped at £115 per point. And there's also a floor. A minimum value has been set at £57.50 per point.
So the final value will land somewhere in that range, between £57.50 and $115, depending on how many total points are claimed across the whole country.
That's exactly right. And just looping back to the aspiration payment, if you claim that back in May,
Yes.
that was calculated at 75% of your potential maximum points, but based on the minimum £57.50 value per point. So that was an early payment, kind of in advance, and it will be reconciled against your final earned amount, which will be based on the actual determined point value when the final payments are made in April 2026.
Okay, so reconciliation happens then. And just one more time, because you stressed it earlier and it sounds absolutely critical.
Yeah.
That MYS declaration window, February 2nd to February 27th, 2026. Miss it, and you miss the payment entirely.
Absolutely. Cannot stress this enough. You could do all the work, meet every single criterion, have perfect evidence folders. But if you forget to log on to MYS and submit your declaration during that specific 4-week window, no payment. It's the final administrative hurdle that simply must be cleared.
A costly thing to forget. And who is checking all of this afterwards? How is it verified?
NHS England, working closely with the NHS BSA's provider assurance team, will be verifying the claims through post-payment review processes.
So they might come asking for evidence later.
Yes. This is precisely why you need to be so diligent about keeping all your evidence, the action plans, the CPPE training certificates, the e-assessment results, the audit data and reflection notes, the DBS check records, evidence of your processes and attempts, even if no patients were identified. Keep it all securely for 3 years.
3 years?
Because if, upon review, a claim is deemed ineligible, maybe the evidence isn't there, or a criterion wasn't actually met, the guidance notes, it will be treated as an overpayment and that funding will be recovered from the pharmacy.
Right. That puts a lot of emphasis on robust record keeping and having everything organized and readily available if or when it's requested.
So bringing this all together now, what's the sort of big picture message from the PQS 2025-26? What does it tell us?
I think it clearly signals the continued evolution of the community pharmacy role within the wider NHS. The scheme directly links that 30-pound-meter funding pot to demonstrating capability in expanding clinical services.
Like Pharmacy First. Exactly. Pharmacy First, the NMS expansion into depression, the PCS expansion for emergency contraception. It rewards pharmacies for getting involved in these newer, more clinical services.
And it's also about strengthening core patient safety measures, too.
Yes, definitely. Through things like the updated mandatory training on sepsis and mental health, the antimicrobial stewardship audit linked to Pharmacy First, and those checks like the enhanced DBS becoming standard.
So it feels like it's not just about, ticking boxes to get the payment. It's more about embedding these advanced practices and safety protocols as standard across the sector. It's showcasing the sector's ability to manage more complex patient needs and really enhance healthcare access right there in the local community.
Absolutely. It's a come-year statement, really, about the expected standards and the level of contribution community pharmacy is now expected to make. It highlights the increasing trust and, frankly, responsibility being placed on community pharmacy teams.
Yeah. This deep dive into the PQS 2025-26 has really underscored the significant standards and the breadth of service delivery expected from community pharmacies in the coming year. The criteria, as we've discussed, cover a lot of ground, emphasizing both those expanding clinical roles and foundational patient safety.
It certainly does. And, it brings into sharp focus an ongoing challenge, maybe even a tension for the sector. All this raises a really important question, I think. As community pharmacy teams are increasingly asked to deliver more services, handle more complex clinical scenarios, meet more training requirements, how can the sector ensure that all pharmacy staff, not just the registered professionals, but the dispensers, the counter assistants, everyone involved, are adequately supported?
You mean supported with the necessary training, but also the time, the resources?
Exactly. The time, the resources, the headspace, really, to feel confident and capable in meeting these evolving requirements consistently, day in, day out, across the entire team. How do we make sure everyone feels equipped for this changing role?
That is a critical point to consider as the pharmacy role continues its transformation. Something for us all to think about. That's all for this deep dive.